is Haley. I'm going to be your nurse today, do your head to toe health assessment. First, I'm going to check that I have all of my supplies with me. And I do. I'm going to perform hand hygiene. Okay. If at any point today during the exam you feel uncomfortable, just let me know and we will stop. Are you feeling comfortable right now?
Yes.
Okay. And are you wearing any assisted devices today, such as glasses, hearing aids, or contacts?
No.
Okay. And I'm going to ask you a few questions. So, what is your name?
My name is Cindy White.
And what's the date?
The date is 11/27/2015.
And where are you?
Lemoyne, Maine.
Okay. Patient is alert and oriented ×3 and communicates clearly. Now I'm going to give you 3 words to remember for the end of the session. And those are summertime, cat, and snowball. Okay. And so upon general inspection, the patient's skin pigmentation is even. There are no visible rashes or lesions. Now I'm going to inspect your scalp. Let me know if you feel any pain or tenderness.
No.
There's no pain or tenderness in the scalp. The hair is distributed evenly. There are no signs of critters. Now I'm going to have you smile and frown and raise your eyebrows and puff your cheeks. Okay, cranial nerve 7 is intact. And I'm going to palpate for your sinuses and let me know if you feel any pressure or pain. So your maxillary sinuses, any pressure or pain?
No.
And your frontal sinuses?
No.
So no pressure or pain in the sinuses. Now I'm going to assess your trachea. And that is midline. And I'm going to assess for lymph nodes. Do you feel any pain or tenderness?
No.
Okay, so lymph nodes are non-palpable and non-tender. And now I'm going to assess for your thyroid. So if I have you swallow for me. Okay, so the thyroid is non-palpable. And I'm going to assess for TMJ. So if I could have you open and close your jaw. And so there were signs of crepitus present, which indicates there's TMJ. Now I'm going to check your nails. So capillary refill is less than 3 seconds. There are no signs of clubbing. There are no visible signs of edema. There's no tenting. And skin is warm and dry to the touch. Now I'm going to check for range of motion of the head, neck, and shoulders. So if I could have you look down for me and back, and then move your head to the side and the other side. And then if I could have you shrug your shoulders and then move them forward and back. Okay, so there is full range of motion in the upper extremities, or rather in the head, neck, and shoulders. And now I'm going to palpate your chest for any pain or tenderness. Is there any pain or tenderness?
No.
There's no pain or tenderness. There is no signs of crepitus. Now I'm going to check for chest expansion by putting my hands at the base of your rib cage and watching for my thumbs to move apart. If I could have you breathe in and breathe out. So chest expansion is symmetrical. Now I'm going to check for your carotid arteries. Okay, so the carotid arteries, there were no signs of bruits, and the pulses were present bilaterally. They were both 2+.
For just 1 second.
now I'm going to assess your eyes. So the eyebrows and eyelashes are distributed evenly, and the sclera is white. The iris is brown and round. There's no sign of ptosis. And I'm going to check your conjunctiva. Conjunctiva is clear. And now I'm going to check your pupillary reactions to light. Okay, so pupils were reactive to light and they constricted consensually. Now I'm going to check your peripheral vision, so let me know when you can see my hands moving.
Yes.
Alright, peripheral vision is intact. Now I'm going to assess your cardinal fields of vision. 6 cardinal fields of vision. You could watch my pen with your eyes. Alright, there are no signs of nystagmus or strabismus. And now I'm going to assess for accommodation. If you could watch my pen again. Alright, so eyes appropriately accommodated, and pupils were equal, round, reactive to light, accommodating, and 3 millimeters. They constricted consensually. Now I'm going to inspect your ears, and they are symmetrical. Do you have any pain or tenderness?
Nope.
Alright, there's no pain or tenderness. Skin is warm and dry. I'm going to check for any drainage. And there were no signs of drainage. I'm going to whisper a word in each ear and have you repeat it back to me.
Phone. Pillow.
Alright, so hearing is intact. Now I'm going to inspect your nose. So the nose is centered. I'm going to check for any sign of drainage. And there's no drainage present. There's no signs of a deviated septum. I'm going to have you close one nostril and breathe in. And the other. Okay, so both nares are present. Both nares are patent.
That's good.
And now I'm going to have you close your eyes and identify a scent for me. And what do you smell?
And sanitizer.
So the patient has no difficulties smelling. Okay, now I'm going to inspect your mouth. You can say ah for me. Okay, so the oral mucosa is pink, moist, and hydrated. The tonsils are pink, moist, and hydrated. The teeth had no signs of plaque. The tongue was pink and healthy and does not deviate. The uvula rises midline, and there is no odor present. And now I'm going to inspect your lung sounds. Have you breathe in deep for me? And I'm going to come around to the back. Alright, lung sounds were clear throughout. There were no adventitious sounds heard, such as wheezes, crackles, or rhonchi. I'm going to inspect your heart sounds now. Okay, and heart sounds are present at both S1 and S2. And now I'm going to inspect your abdomen. If you could lay down for me. Do you mind if I pull your shirt up? And is there any pain or tenderness?
No.
So there's no pain or tenderness in the abdomen. Skin is warm and dry. There are no lesions or rashes present. I'm going to check for vascular sounds. There are no bruits heard. Now I'm going to check each quadrant for bowel sounds. Okay, so bowel sounds are present in all 4 quadrants. Now you can sit up for me. And I'm going to inspect your legs for any pain or tenderness. Any pain or tenderness?
No.
There's no pain or tenderness in the legs. Skin is warm and dry to the touch. There are no visible rashes or lesions. Now I'm going to check for your dorsalis pedis and posterior tibialis pulses. Okay, the pulses were equal bilaterally and they are both 2+. And now I'm going to do some strength and range of motion in your lower extremities. So if I could have you push up against my hands. Okay, and then push back against resistance. Okay, and then if I could have you move one leg in a circle. And so your ankle. And then the other leg. And the ankle. Okay, so there was full range of motion in the lower extremities and no signs of crepitus. Now I'm going to have you stand up and touch your toes. And I'm going to check for any curvature of the spine or signs of scoliosis. Okay, and there were no curvatures in the spine, no signs of scoliosis, lordosis, or kyphosis. Now I'm going to have you put your arms out and push up against my arms, and then push down against my arms. Okay, and then I'm going to have you put your hands above your head and down, and then out to the side, and move your arms forward in a circle and backward in a circle. Okay, and then I'm going to have you bend your arms in as if you're doing a bicep curl. Okay. And there was equal strength bilaterally in upper extremities and full range of motion. Now I'm going to have you perform finger to thumb opposition. Okay, patient's fine motor coordination is intact. Now I'm going to have you close your eyes and stand on one foot. And then the other foot. Okay. And now I'm going to have you walk to the door and back. Alright, so the patient's gait was fluid and smooth. The patient's posture was upright and there was appropriate balance and coordination present. Now I'm going to have you close your eyes and I'm going to assess sensation. So just tell me where you feel the cotton ball.
Right arm. Left hand. Right leg. Right hand. Left arm.
Okay, so the patient's sensation was intact. And now I'm going to have you repeat back the 3 words that I had you remember.
Snowball, cat, and summertime.
No.
Okay, so the patient's memory is intact. And now I'm just going to make sure that I didn't forget anything. Okay, and I'm done.
Okay, thank you.